Well, first of all, Senator Kuehl, thank you so much for holding this briefing and for the work that you've done, and to the other state senators and assembly people here who have worked for free universal health care for every citizen of this state. In making this film for the last couple of years, actually the film grew out of a story I did back in 1999. I had a TV show called The Awful Truth, and I became aware of a young man who was fully covered by Humana Health Insurance, one of the largest health insurance companies in the country. And he worked full-time at a national drugstore chain. His diabetes had reached a point to where his doctor decided that he needed both a kidney and a pancreas transplant. Humana, his health insurance company, approved the kidney transplant but denied the pancreas transplant. The reason why the nurses are laughing is because they know without the pancreas, the kidney, and the life doesn't continue to exist. It's one of many ways that health insurance companies try to trick up the system, make it look like they're doing something for their clients, when in fact their bottom line, their primary goal is to make as much money as possible. I took this young man to Humana headquarters with my camera crew, and I asked them if they would please pay for his pancreas transplant. They said not only would they not do that, they showed us the door. But out on the front lawn of this headquarters of Humana in Louisville, Kentucky, as we were ushered out, we then decided to hold the man's funeral a few months in advance of when he'd actually be dead. So with the man present, and his priest, and the pallbearers, and the bagpipes, and the casket, we conducted his funeral on the lawn of Humana Health Insurance Systems. They were so appalled and embarrassed and frightened by what we had just done and how this would look on national television, that within 3 days they agreed to pay for the pancreas transplant and thus save the man's life. Although that ran for only 10 minutes on a cable channel called Bravo, I began to think at that moment, if we could save one man's life in 10 minutes with nothing more than this tool, this camera, and a microphone, what else could we do? And so I thought, what could we do in 120 minutes? How many lives could we save? And initially I started out by, let's go after Aetna, let's go after Blue Cross of California, let's really take on these people. And then I thought, but wait a minute, that's going to miss the point here. The problem isn't just Blue Cross of California or Humana or Pfizer or Eli Lilly or the Hospital Corporation of America and the Frist family. The problem isn't just them. The problem is the system itself. It's the system that's broken. And fixing one little piece of it here and one little piece of it there is not going to provide universal health coverage for all Americans. It simply won't happen in our lifetime if we continue along this path. And so I began to feel that what had to happen here was a complete change in this system. I don't know how many people are aware of this, but the number one cause of bankruptcy now in the United States are medical bills. The number one cause of homelessness are medical bills. And in this film that you'll see tonight, we obtained some of Nixon's famous White House tapes. But these aren't the discussions about Watergate. I will show in this film, on February 17, 1971, a conversation between John Ehrlichman and Richard Nixon. And they are about to put forth the bills that would bring us the modern-day HMOs. And Ehrlichman says to Nixon, now, there's one more piece of this we have to figure out. We want to talk to the Vice President about this, and it's about these health maintenance organizations like Edgar Kaiser's Permanente thing, as he put it. And Nixon interrupts and he goes, I don't want to talk about any of these damn medical programs. And Ehrlichman goes, no, wait, this is a private enterprise one. And Nixon goes, oh, okay, I like that. And then Ehrlichman essentially boils down what would become the health insurance system that we now have today. Ehrlichman says to Nixon, the genius of Edgar Kaiser is what they want to do here is to try and provide as little care as possible so they can make the biggest profit possible. And suddenly Nixon lights up. And he says, oh, okay, this is great, fine, not bad, let's do this. And that's what they did. Once they understood what the basic premise was, that it was to provide less care for more profit, that was something that they loved. And that is the system that we have. And the reason why, as our friend here said, the reason why we have to eliminate health insurance companies, I mean, they literally have to be removed from the equation. The reason for this is that there's no room for them, because there should never be room for the word profit when you're trying to make a decision whether or not to provide somebody care when they get sick. Bottom line, you can never allow this to happen. And they can't make a profit unless they deny care, unless they deny claims, unless they keep people off the rolls who have pre-existing conditions, or kick people off the rolls who have diseases that become too expensive for them. They can't make a profit. And so let me just pause for a second and say something on behalf of the health insurance corporations in America. Our laws state very clearly that they have a legal fiduciary responsibility to maximize profits for the shareholders. If they don't do that, they could be put in jail. So they are required by law to turn as big a profit as they can. And the only way they can turn the big profit is to not pay out the money, is to not provide the care. So therefore, there's no way that this can work. There's no way that we can continue to have these health insurance companies making these decisions. Nor should we have private profit-making hospitals making decisions. A hospital that has to make a decision based on the bottom line as to whether or not they're going to provide care, this is absolutely antithetical to basic human rights. And we're the only country in the Western world that doesn't believe that it's a human right to provide free, universal health coverage for every one of its citizens. We're the only country and this is what's so amazing, isn't it? Because we're all Americans. You know, we're amongst the most generous people on earth. We're a good people. We have a good heart and a good soul, and we have a conscience. We know right from wrong. And the fact that we would allow 9 million of our children to go uninsured, 9 million children across this country, we won't even insure the children in America. What is wrong with us? That's not who we are. That's not what we used to be about. You know, this every man for himself attitude, pull yourself up by your bootstraps. You know, you got your problems, I got mine. You know, don't bother me. You know, this me. That's not how they exist in these other countries, in Canada and Britain and Ireland and France, these other places. They believe in we. They believe we're all in the same boat and we sink or swim together. They believe that if too many people fall between the cracks, their society suffers as a result of it. What happened to us? I think we used to believe that somewhere along the line, somewhere way, way back. You know, my grandfather was a country doctor. He was paid with eggs and milk and a chicken every now and then. You know, he did it because he cared for people. He didn't do it to make money. You know, the sad thing about the American Medical Association is that they have fought every good reform for the people of this country. In the last century, they fought Social Security. They fought Medicare. You'll see in my film the head of the AMA back in 1962 giving a big speech about how dare we help old people with Medicare. It's really weird to look at it now, like to actually see a doctor saying such a thing. But that's where the AMA, well, I think a lot of doctors these days, and of course the AMA, they were all behind the HMOs when Nixon and that whole thing started in